What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses. It is time now for the Monday edition of the Virus Update for Monday, October 6th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, but not enough information and education about what is going around. Yes, you need to know what's going around. Want to stay informed of just what viruses are going around? Subscribe to my channel down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Already, we're looking at about maybe a 10 to 15 minute video today. Trying to keep this video shorter. It's been very hard to record today. It's been a lot of interruptions pretty much all afternoon. I thought we were going to be out in the wild today. We decided not to do that, and quite frankly, we should have done an Out in the Wild update. But you know what? You're going to see a couple things today that are going to make you think, is this 2025, or have we gone back in time? Stick with me. It will make sense to you in a few minutes. All right, starting off with this. World Health Organization, WHO, reports global SARS-CoV-2 positivity is at the highest level in about 11 months and rising as of October 1st. Update for the week of September 21st. I suspect that this might have been the case. Why? Because Europe is seeing a big increase right now in COVID. The United States is still elevated but dropping. Just a combination of things. Similar deal over in places like Australia and New Zealand. Things are still elevated there but coming down. All this put together in a combination does result in rising positivity rates, especially because of what's going on in Europe, the UK, many countries over in Europe. We talked about Greece yesterday. Things are going up there as well. So yes, we are seeing, and you can see that on this chart here, that the positivity rate globally is rising, and it's approaching 10% at this point. All right, moving on now to this from Mike Horger, his PMC COVID update for the week of October 6th, 2025. And we don't have a lot of data. There's that CDC blackout. You can see here, it clearly shows on here that we don't get the state-by-state data. But what we do know is he can use data from BioBot. And with that, he estimates 1 in 81 people are estimated to be actively infectious at this time. PMC estimates 602,000 new daily infections amid shutdown and state-level data blackouts. So yes, we're still pretty far up there, 602,000 daily infections, but we're way down from that level that was over 1 million just a few weeks ago. So we've come down pretty quick, and this is some good news. And it looks like his forecast continues to expect things to drop through mid-month or the end of his forecasting period. So that is really some good news. We'll have to see what happens at the end of the month. As you all know, Halloween's coming, and from a perspective, coming from someone who used to do Uber rides myself, back in the day, I can tell you this much. There's a lot of parties with Halloween. Also, I'm watching for a regional potential, maybe stall in any drop in the Northeast. Leaf peeping is a big deal in the Northeast. It's a big deal in anywhere in the mountainous regions of the United States. Those areas, local communities, could experience outbreaks of COVID as a result of just large crowds of people. It is a thing, but on the national level, we are expected to continue to drop through the end of his forecasting period. So that is some fantastic news. Alrighty, I don't even know why I'm showing this, but I will. BNO, no weekly update this week because there is still a government shutdown at this time. Alrighty. Moving on now. Thought I had a story here about... Yes, I do. You got to see this. Switzerland. Expert advises voluntary mask wearing. Haven't heard about that in a while. Yes, epidemiologists in Switzerland warn of severe infection season. Masks in crowded indoor spaces or on public transport help prevent infections and show solidarity. Extra care for those 65 plus, immunocompromised, and those with cold symptoms. How about that? Bet you didn't expect to see that? Guess what? It even goes a step further. Oh yes, it actually goes a step further. Somewhere here in the United States, in California, they are now advising masks. In fact, for healthcare workers, it's now being you need to wear a mask. That's right, in Sonoma County, California, masking has been ordered for some healthcare workers through March. Now, it's not for everyone. It should be for everyone, but it's not. Again, I'm not going to tell you what you should actually do, but it just makes sense when you're in a healthcare setting. I mean, you do have high risk people. You could get sick yourself. I mean, you deal with sick people in some cases, like at hospitals, emergency departments. But let's read what this is. Sonoma County's top health officials on Monday issued a mandatory masking requirement for certain healthcare facilities, a move aimed at curbing the spread of influenza, COVID-19, and other respiratory viruses during the fall and winter months. Affected facilities include skilled nursing homes, certain areas of long-term care facilities where nursing care is provided, acute and non-acute rehabilitation facilities, infusion centers, and dialysis centers. I'm a little confused though. Why not include emergency departments? Do you not deal with flu positive, COVID positive, RSV positive, in some cases norovirus positive, and all the other respiratory viruses and any other type of virus? I mean, it just makes sense, doesn't it? I don't know. I mean, I'm glad they're at least going this far, but I mean, I think it should be taken a step further. And hey, at least they get it. They saw that last winter was oh so bad for the viruses. They're taking this preventative measure. I think it is fantastic that they are at least doing this. All right, moving on to, I believe this is Ireland. A COVID outbreak forces Wexford Post Office to limit services. A lack of staff due to COVID outbreak has forced a Wexford Post Office to greatly reduce its services for a period of time. Yeah, outbreaks, I'm telling you, Europe right now is not doing well at all with the viruses. Moving on to New Zealand. We talked about this before. We have to give you an update. New case of measles confirmed in Northland. Outbreak. Yes, this measles outbreak continues to get worse. One new measles case has been confirmed in Northland over the weekend, bringing the national total now to 11. So we've been watching this outbreak grow, and it does continue to grow. Let's see what's going on in Canada. The viral activity level for COVID-19 in wastewater is moderate. Flu A is low. Flu B is low. RSV is also listed at low at this time. Taking a look at what's going on in Pinellas County, Florida, we do see sick person calls showing up a few times. Taking a look at Philadelphia, and I apologize, we need to get this fixed. It still says Friday for some reason, and we want this to actually say Saturday and Sunday. Let's see, do we have the Saturday number? And let's see. Well, here's the Sunday number. 810 EMS incidents. Did they just literally skip over the Saturday number? I guess they did. So 810 EMS incidents on Sunday, October 5th. Taking a look now at what is going on with this. We were supposed to get an update in Philadelphia this week. We do not have it yet for the COVID update. Taking a look at what is going on now in Montgomery County, Pennsylvania, and we do see there is, unfortunately, a couple cardiac arrest calls right now, and several other things going on at the moment. Taking a look at what's going on in Chester County, Pennsylvania, not too bad, but there are a few calls at this time. Taking a look at the hospital situation, it's a Monday. Hospitals can get busy on a Monday, and take a look at this. The Lehigh Valley region in Pennsylvania is really bad, as is, there's several hospitals in northeast Pennsylvania not doing great right now when it comes to patient volume. They are dealing with issues at the emergency department. In New Jersey, we are seeing Inspire Medical Center Mannington having a problem. Inspire Medical Center Mullica Hill is doing issues with full and total divert, as is University Hospital. RWJBH University Hospital in Hamilton is also dealing with patient volume, and Virtua Voorhees Hospital is dealing with emergency department volume. High volume with 37 people in the waiting room and 11 holds. Ooh, wow, that just does not sound good at all. Here's the Monday update from New York State. 473 cases have been added on the most recent update. You can clearly see New York State is continuing to come down at this time, as is the hospitalizations. 435 people in the hospital, 34 people in the ICU. That is some fantastic news. Alrighty, taking a look now, we'll take a look at just a few wastewater sites. Starting off with Boston, let's see what's going on there. COVID is listed at medium, and you can see here kind of level at this time. It's come down from where it was. It's still, again, it's listed at medium. Hey, norovirus has come back down. Everything else looks to be fine at this time. Let's go to somewhere out on the West Coast now. How about we take a look at what's going on in the Los Angeles area, shall we? These are some really big wastewater sites. 3.5 million population at this one. Low for COVID. And EVD68 has come back down. Hepatitis A. Wow, a lot of detections of that, but overall this wastewater site is doing well. Let's go to somewhere in the southern U.S. now. How about we take a look at what is going on? I would say, let's try Tallahassee, Florida. I don't know. Can we see that? The data here gets broken up, but you can see here, COVID is listed at medium. You can clearly see where their summer surge was. They have dropped considerably from there. Norovirus is medium and is rising at this time, so that's something we're going to have to continue to keep an eye on. Let's make our way on up to the Midwest now. How about we go up to Carmel, Indiana? I'm seeing low levels here. Let's see what the wastewater site shows. Everything is low with COVID, RSV, flu. Yeah, this wastewater site's doing pretty well. Influenza A is also low at this time. Now let's make our way back out to the west once again. We're going to go way west now. Let's go to Hawaii, shall we? How about we go to Sand Island in Honolulu and see what's going on there. Medium for COVID. RSV is rising slightly. Still very low, though, but we'll have to keep an eye on that. Norovirus is medium, dropping somewhat, and there are some detections of hepatitis A at this time. Alrighty, folks, that's really all I have for you today. If you enjoyed today's virus update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Let me know. Are you surprised to hear about two different places, one in the United States, one somewhere else in the world, actually talking about masking once again? That really is a surprise to me, but maybe people are learning after what happened last year. Alrighty, folks, I will see you again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching. Take care.